It's the second lab-confirmed measles case so far this year in Toronto. An infant who recently returned from travel and is now recovering at home. But Toronto Public Health is warning the public of a possible virus exposure last week at a magic show here in Agincourt.
We do know that they were at the Agincourt Library on Monday, March the 11th, between 1 p.m. and 5:30 p.m. when they were contagious. And so we are certainly asking the public, if anyone was at the library during that time, that they should take precautions.
This includes checking your vaccination record to ensure you have 2 shots of the measles vaccine and monitoring for symptoms until April 1st.
So if you start feeling unwell, fever, cough, sore throat, runny nose, red, itchy or watery eyes, and then that rash that starts at the face and goes top to bottom, or if you get these white spots inside your mouth.
Toronto's first case of measles this year was reported in February, also in an infant who had recently traveled, an at-risk population, as the first vaccine isn't typically scheduled until 12 months old.
But it's important to recognize that if families are traveling with children under the age of 1, you can actually bump up that first dose of the measles vaccine to 6 months of age.
Infectious diseases specialist Dr. Isaac Bogosh says to prevent community spread, immunization rates need to go up as routine vaccinations took a dip during the pandemic, particularly in school-aged children.
Of course, we can't control what happens outside of our borders, but we can control what happens inside our borders. And we can do everything possible to get vaccine rates well above 90%, such that when we do see those inevitable imported cases, that we just don't see that onward transmission here in Canada.
Toronto Public Health says we can expect more cases of measles this year due to the global increase. In 2023, there were a total of 4 confirmed cases in Toronto. In Agincourt, Mackey, City News.